Okay, Gal's going to make me start off my presentation tearful. Thank you, Gal, for that introduction. Just a little bit of context about what VP of Safe Housing means at Domestic Violence Intervention Services is that I work with a very large team of about 40 other professionals to provide support 24/7, 365 crisis support to an emergency shelter for survivors of violence, both adults with children and single adults. We're an inclusive shelter, so we serve everyone who's a survivor, and that's a 90-bed facility, and then also a more long-term program that is transitional housing that is 20 on-site apartments for survivors and their families. And my pronouns are she, her, and hers. Okay, so I wanted to give everyone a really clear idea of what we would be talking about today. So I'm going to give a little bit of context for our work in Oklahoma as it applies to domestic violence, because that's where I'm coming from. We'll dig into a little bit of bias that comes up in working with survivors, common barriers, being able to recognize lethality indicators. That's certainly a really large portion of the work that me and my team do. Trauma-informed responses to disclosures, special considerations for kiddos, and then just being in connection with one another. I hope that we're able to kind of share this space because we are building the communities of compassion for survivors. And then we'll have a Q&A, as Gal mentioned. What we will not discuss, this is maybe just as important, we will not discuss any confidential information. I will not go over basic terms and definition. I'm arriving here with the assumption that we all have a foundational knowledge of domestic violence. I will absolutely not go into war stories or violent experiences that I have been exposed to in my work. There's a lovely colleague of mine named Margaret Black, who shared an article that I have linked in my resources about sliming, and it's about trauma-informed disclosures in our work, and it's really important that maybe we're really thoughtful about what we disclose when we talk with one another. So I will not be sliming anyone in this space. That's my commitment. I'll refer to some research, but I'm certainly not going into in-depth research studies, clinical interventions to address trauma, complex safety planning, although we will touch on safety planning, and I'll provide some resources in my PowerPoint. And we won't talk about prevention necessarily of domestic violence, but these last 4 bullets are certainly hugely important to the work that we do, but in 45 minutes, you kind of got to pick and choose. Okay, so again, I already mentioned kind of trauma-informed responses. We talk a lot about vicarious trauma at DVIS in our work, and I would be amiss if I didn't just acknowledge just the word domestic violence can bring up some pretty strong emotional responses from many of us. I myself am a child survivor of domestic violence, so this is deeply personal work to me. And with, I think Gal told me there were 50-something people registered. I think we have 30-something now. The CDC says, 1 in 4 women and 1 in 7 men will likely experience intimate partner violence in their lifetime. So there are certainly survivors in this space with us. So I just want to acknowledge that. And then just again mention the limits of confidentiality. Some of us don't have our video up. We don't always know who else is in the room. We may not have our actual name on our video, so we just really don't know who else can hear or read in the chat or hear what we say. So please kind of share the plot, not the characters. If you do, when we get to Q&A, you want to give a scenario, please don't say like my neighbor is experiencing domestic violence, because there is a chance that somebody knows who you are and knows who your neighbor is, and their confidentiality around survivorship. We got to work together to protect it. Okay, so domestic violence in Oklahoma, we are doing better now than we've done in over a decade. 2019 data tells us that we're now ranked 20th in the United States. I think previously, the last decade, we've been in the top 5. when I think about why that might be, there's a lot of things that come to mind, but certainly something I've learned in the last few years is that Oklahoma was the first state to legislate the Lethality Assessment program starting in 2014. So the Lethality Assessment program is a multi-tiered response to prevent DV homicide. It is based on some pioneering research by Dr. Jacqueline Campbell out of Maryland. She basically started doing some research and wanted to know how she could give victims information to know when they're at highest risk, specifically of homicide, and be able to really empower them to know their risk. And then that kind of developed into professionals really finding this information really helpful, including law enforcement. So in Oklahoma, if a police officer is called out to a domestic call, they now use this evidence-based assessment tool to ask the survivor what's going on in the home. They separate them, get them to a safe place. And if they answer yes to certain questions, that automatically prompts the response. They're given the option to be connected to a hotline, a domestic violence hotline, or some local advocates to do more in-depth safety planning, talk about access to shelter, learn about resources. And then again, it's just giving us all kind of common language to use. So DV advocates, law enforcement, survivors, we all are kind of using this uniform language, which is really helpful. Another interesting thing that it does is really, think about, we talk about burnout in our work, think about law enforcement officers who are maybe showing up to the same homes over and over on domestic calls and just not knowing really what to do if the survivor isn't ready to leave. This really gives them like a strong tool that they can use. And again, it's evidence-based. So instead of doing, there's a law enforcement presenter that I love named Mark Wynn, and he talks about porch counseling that law enforcement used to do. So they would show up, they'd pull both people out on the porch and they would shake their finger and say, "Don't make me come back out here anymore," right? Which is absolutely not effective. That does not do anything to prevent domestic violence. So this really gives them some foundational knowledge and a really useful tool, and us too. And I'll talk a little bit more about some of the questions and what we're assessing for and how we use it at DVIS. Okay, moving on. Domestic violence related crimes in our state are considered non-violent. So what this means is that I can go to the grocery store, which I'm not doing now, but let's say I did, and I choose to assault someone in the grocery store. I get a violent charge of assault and battery. Meanwhile, I'm in my home, I do the same thing to my partner. That is a non-violent assault and battery. Doesn't really make much sense. That's how our laws are. And there is some movement on DV advocate side to maybe change that. At the same time, most of you know that Oklahoma incarcerates more people per capita than like anywhere, specifically women, but we just love locking people up. We are really in a criminal justice crisis in our state. So there are also really cool justice reform advocates doing really cool advocacy and trying to do some policy change. But those two things together are kind of butting up against one another. I'm certainly not saying one is right or one is, if you're interested, do some research, read some articles, but it's creating some interesting context for our work in this state right now. So now to dig into some of this personal and provider bias. Now, when I was creating this, Gal just said, like, the sky's the limit, present on what you want. And so I was like, oh God, there's so many things, how do I pick? So I tried to kind of build my presentation where it can be implemented in our personal lives, because we are people in the community with family and friends and faith communities and places of employment, all that good stuff. And then we're also, most of us, I'm assuming, probably have some interfacing potentially with survivors. So this can be applied in either setting. So some biases that come up a lot and kind of snag us are our own beliefs about what should be tolerated in relationships. I'm sure you've all heard this before. I would never let someone treat me like that. That's us assuming that we know what is happening within somebody else's life in relationship. And you know, we have very, very different experiences, all of us. So that is a scary place to put a survivor in that place of judgment. Our own beliefs about an ability to leave. So why wouldn't you just leave? I would never let someone treat me like that. And if they tried to, I would just leave. Well, as most of us know, DV is much more complicated than that. And it's not as easy as just leaving. Our own beliefs about violent partners, that they are, we love to do this like black and white binary thinking with everything in this country specifically, but we like to think that people are all good or all bad. And that kind of ignores the fact that a lot of relationships start out good and victims really care about the person that is potentially hurting them. And this kind of belief just adds to the shame and guilt and things that survivors feel anyways. And then our own beliefs about truthfulness. So we get into this whole narrative in our head or within our circles about, well, she's just such a great mom. She would never do that. Or he's such a, a good member of our church. Or they just seem so nice. They've been my neighbor for 20 years. I've never heard any commotion. I just can't imagine that they would do that. Really not a fair bias to be holding when we're talking about survivors. And then the gender bias, like we assume that only men can assault women, and we know that that isn't true. So you hear things like, but you're a man, how could you possibly be abused? You're 6 foot tall, she's 5 foot tall, what do you mean? Or things like, but you are a woman and you're dating a woman, what do you mean that there's violence in this relationship? We have all these ideas about LGBTQ relationships. 1, we forget that they exist, so we go back into that heteronormativity, and 2, then we're very confused when there's violence happening there. So that those are all kind of traps that we can find ourselves in when we're thinking about domestic violence. And feel free, if anyone can think of other ones that have come up in your life, you can pop them into the chat, and we'll circle back to them towards the end, because I know every slide there's like 1,000 things that we could put in here, and I think it's good to kind of highlight quite a few of them. Okay, so why can't they just leave? So at the top we have more interpersonal micro type barriers. So there's obviously the emotional barrier of you care about this person potentially, and it's just hard to like just upend your life and move houses or go to shelter or kind of break up a family. That's really, really emotionally taxing. There's the financial piece, that it's really expensive to start over. As we know, a lot of survivors, we often think about they are not allowed to have their own employment. They're not allowed to manage their own money. They don't have their own bank account. But what we also see at DVIS is a lot of perpetrator will require that the victim take out the lease or the mortgage in their name. So then if they stop paying, if they destroy the apartment, that all follows the victim, not the perpetrator. Taking out utilities in the survivor's name. And then also when we talk about leaving, sometimes when perpetrator loses control over the person within the home, then maybe they show up at their workplace and start causing problems there, again, because they know that if they cut off that financial autonomy, that they can maybe gain more control. And so that's something that we commonly see, especially at the shelter. Survivors will say, well, they showed up at my workplace and my boss is stressing out and everyone's freaked out and I think I'm going to get fired. So this is not an uncommon tactic. Psychological, you're living with people saying things that are kind of chipping away at your self-esteem. You're maybe hearing threats. Just a whole living in that power and control environment can really inhibit your ability and create some new barriers, inhibit your ability to leave. Kiddos and pets. With children, think about if the person who's hurting you is the children's other parent or guardian, that can really make things complicated. Sometimes perpetrators will say, well, I'm going to call DHS and I'm going to tell them that you drink or that you use drugs or that you, went to the neighbor's house last night and you weren't here to watch the kids, or I'm going to make things up. And a lot of times survivors, it's really hard for them to not believe what the perpetrator is saying. And we do see this happen, right? I'm sure people who are here representing DHS and other systems know that this is something that really happens. And then pets, it's not uncommon for both kids and pets to receive threats within DV homes. I'm really thankful that at DVIS we have a kennel, so cats and dogs can come with their families, and people don't have to choose between the safety of themselves and their pet. But obviously not every shelter has that option. There's a limit, you know, if you have like 2 horses and a mule and 3 dogs, we might be like, we don't know what we can do with those animals. So that's a barrier to leaving, certainly, especially as pets are such a part of our family. And then on the bottom row, lack of access to help or perceived lack of access to help. You know, this is really important when we're thinking about rural communities. There truly just aren't resources available, maybe where that person lives, or they've been so sheltered and isolated that they just can't even imagine that there are services available to them. Maybe there's a fear of judgment. We see this a lot, again, with maybe perpetrator's family is your primary support system, and they don't know that this is going on, and they're having a hard time believing that this is going on. So there's fear of judgment there, again, from like your cultural background, your own community, your faith-based community, your place of employment. I mean, this judgment can come from lots of places. Previous negative experiences with systems. This is maybe a little more like mezzo. You see people maybe trying to reach out for help and getting a really negative experience. I have at the very end this targeted identities. So thinking about, you know, if you're a person of color and you don't feel safe to call law enforcement, if you identify in the LGBTQ community and you have reached out for help before, and, you know, your pronouns haven't been respected, or how you choose to live your life, or what type of relationship you have is treated in a marginalized way, that can be a huge barrier. And then this square on immigration and history of incarceration, we see this used a lot. One, survivors are smart, and they know that if they maybe aren't a US citizen in this current cultural climate, that there could be some unusual, maybe not unusual, some safety concerns around that. Perpetrators will often use that too, like, I'm a citizen, you're not. If you call police, you'll get deported. Or they'll say, I'm gonna just call ICE and have you deported if you don't do X, Y, and Z. And then the history of incarceration can really be used against the survivor. Either they know that they have a warrant, or that they have this previous history with these systems that did not go well for them, and so they're hesitant to reach back out. We often see survivors mislabeled as the primary aggressor when law enforcement gets involved, and it's really hard to undo that damage. So those are all factors. Now, this is another slide where I would say, if you can think of others, or there are things that you're like, I can't believe DeJon didn't put this on there, feel free to pop that in the chat and we'll circle back to it. Because again, there's just kind of an unending list of things that can come up and be a real barrier to survivors leaving a violent home. Okay, a little more heaviness, and then we're gonna take a little shift. So these are pulled from, not all of them directly from, but pretty close to it, from Jacqueline Campbell's danger assessment. Again, I have it linked in my references. Probably a lot of you are familiar with it, but these are common things that we are screening for at our shelter to assess what type of danger the survivor who's calling or coming in is in. So used a weapon to cause harm, or threats with a weapon, is huge. Threats to kill the victim or their children. If the victim thinks the person will try to kill them, that is huge. A very important question to ask, even though it's really hard to hear that answer. Strangulation, there has been a lot of research and new information, and probably long before I was at DVIS 4 years ago, but certainly since I've come to DVIS, you know, I used to hear people say, well, you know, they kind of choked me, and I would think, oh, that's not good, but I had no idea how truly dangerous strangulation is. Now I think most of us are probably aware that it's less about stopping the breathing, and it's more about stopping the oxygen to your brain that can within seconds cause some permanent damage to your brain functioning, along with a myriad of other really serious issues. I also have a resource linked at the end if you want to know more about that. I won't go into it too much further, but your the likelihood of you being killed by your partner if they're engaging in any type of strangulation is pretty severe. Access to a firearm, and us being in Oklahoma, where pretty much, you know, every other household has a gun, this is really concerning. Extreme jealousy, control, constant surveillance. The constant surveillance is getting more and more interesting with technology, because there are all kinds of wild ways that perpetrators will track the movements. I mean, you have GPS stuff. There are apps that can monitor every like keystroke and app and message. This one is a hard one for us to keep up with, because it's so rapidly evolving, and obviously not all of these apps and ways to engage in surveillance are made for domestic violence perpetrators, but the more tech savvy people are figuring that out and using them. We've had survivors with like apps on their phone that are labeled like a calculator, and they just thought, oh, I thought that this was just standard on my phone, and it's actually like some type of weird GPS app. Not to freak everyone out, but it is, that tech piece is pretty concerning. And then this has the victim recently left perpetrator after living together or being married. Going back to the previous slide on why don't they just leave? It's really easy sometimes from the outside to think if they could just go, then they would be free and they would be safe. But what we actually know is that survivors are at the highest risk in the process of leaving through the first year of being gone. That's when we can see violence really spike. We call those sometimes precipitating factors, that process of leaving. So again, just adding to the complexity of barriers.
DeJon, Kendra wrote in the chat that exactly what you said, that fear because leaving can be extremely dangerous. Which is so right. In Israel, since coronavirus started, 6 women were murdered. And it was just because they wanted to leave their partners. Only from the 6 since Corona started. It means like in 2 months. So yeah, so the leaving is a huge trigger. Yeah, definitely.
It is. Thank you, Kendra, for sharing that, and thank you, Gal, for monitoring that. So we're going to do a little bit of shifting, and I told you all that I wasn't going to slime you, so this is a peaceful photo that I had on my phone from right outside of Taos, New Mexico, from the fall, pre-COVID. So we can just take a moment to pause, maybe take a deep breath. I know I need one just to regulate a little bit and give ourselves a little moment to breathe. Okay, I'm going to continue on. So this section I kind of thought about, okay, somebody has disclosed to you either in your personal life, in your office, at work. What do people need to know? This is something that people often say, like, I just freeze, I don't know. So I'm going to give you some stuff to help prevent that freezing response. So listen and be willing to hear difficult things. Domestic violence is just a really, really ugly, dark part of our culture, communities, human experience. And if we're going to work with survivors and build compassionate communities, we really have to be prepared to hear difficult things. I'll just highlight, as our children's team reminded me, that it's really important that we do this with children too, that we hear difficult things from children. We'll talk a little more about that. Listen more, really listen, actively listen. We just cannot say it enough. Please believe survivors, hear survivors, and believe survivors. Express support and concern. Explore the survivors' ideas of current needs and safety. Ask questions related to their current needs and safety. Offer to connect them to national, state, local domestic violence agencies for safety planning and resources. I know sometimes people are like, this, friend of mine is not ready to reach out to an agency. Cool. So maybe find out if it's safe, if they have an email that's safe for them to send a link to, or give them this website. Say when you get a chance, Google it. Most of the national websites have like a quick escape button from the website that it'll completely like erase it from your browser history and just change it to something else. So that could be maybe an option, or just see if they're willing to like call a local hotline, just a safety plan. You do not have to be ready to leave to access safety planning and additional resources. We often have survivors call us multiple times over years, not necessarily seeking shelter. They just are saying, here's what's happening now. We're able to highlight certain lethality indicators that we're hearing, safety planning, helping them. You know, when we're in crisis, we tend to get real tunnel vision, and it's hard to maybe see our internal resources. So survivors can access that. Please encourage them to do so. And then I would be amiss if I didn't highlight mandated reporting. Children are in the home and domestic violence is happening. I'm not going to say like a blanket statement and that you call every single time. We certainly don't, but do we call a lot? Absolutely. There are a lot of things that we take into consideration, but I would just encourage everyone to like make sure that you're familiar with your mandated reporting laws, which in Oklahoma is every single person here. And then be looking at your own code of ethics, your own licensing board requirements, the agency that you're working for, kind of what their stance is, and you kind of formulate those all together. Seek supervision, staff, and then at the end of the day, call if you think that a child is being neglected or abused, because that's really what we're tasked to do. Okay, so I don't know if I already mentioned this, but when I first created this PowerPoint and thought I was finished, I went through it and then I was like, oh, I didn't say anything about addressing this issue with children, and that is not gonna work. So I reached out to our children's clinical team and they were wonderful, and just yesterday morning it was like, I know this is last minute, but here's what I'm thinking. Is there anything I'm missing or that I need to add? And they quickly responded with a wealth of extra information. So I'm going to share that now. So when we're talking about kiddos and domestic violence, it is imperative that we as supportive, stable adults let the child know that it's not their fault. Jordan, one of our clinicians, gave the example of, say, kiddo is playing, dumps out all their Legos. Sorry. Is told to pick them up, doesn't pick them up, a fight ensues with the adults, someone gets hurt, still child needs to know that is not their fault, right? Kids need to know that they have a right to feel and to be safe, and that it's really the adults that have the responsibility of making that happen. We can help children to identify their feelings and experience them. This includes the painful emotions. So one of the other clinicians, Catherine, said this has been really important to her work with children and families experiencing domestic violence, is that kiddos have big feelings and they have the right to those. And what we like to do sometimes is like, no, don't be sad, don't cry. We just want to fix it. We don't want children to be sad. But when we really like stifle those emotions and don't let them truly experience them, we're not letting them learn about emotional regulation, be able to access the full range of human emotion, which is really what makes life really cool, even during hard times, is that we can experience both joy and sorrow. So really allowing kids in an appropriate way to identify, feel, and experience their emotions, even if they're painful. Setting healthy physical and emotional boundaries. So consent. We cannot stress this enough. We need to teach kiddos at a young age that they have the right to bodily autonomy and even a high five. We can say, hey, can I give you a high five? Asking permission goes a long way to teach them about, again, bodily autonomy. We can, this is maybe not in exactly the middle of crisis, might not be the most helpful time, but as a family is kind of working through this, we can help educate the parent on the impact of DV on kiddos, coach them on how to talk about what has happened and what they are doing to keep their child safe, like learning the language of how to tell their child that. This is absolutely not a time for ignoring or making up stories. what we see sometimes is that kids in our domestic violence shelter have been told that they are on vacation. And what a cruddy vacation this is, where they're confused and they're with all of these other people who are strangers and they're sharing spaces and everything is uncertain. This, you know, most of you who work with kids know, but this applies to lots of scenarios. I have a friend who recently lost someone in her family really traumatically. Due to a suicide completion, she has chosen to tell her children that this person just went to sleep and didn't wake up. And what I want to say is, how are your children sleeping right now, right? Because they're probably not sleeping very well. So we can find age-appropriate ways to tell children hard things. Also, we all know it, who have been around kids, who have kids, we've all been children. Normally kids know better than adults what's happening. I mean, they might not have the language to identify exactly what, but they understand that things are not right and things have not been safe. So there's really, once it's happened, we can't like go back and erase it. We can help the parent to develop some positive parenting skills and emotionally responsive caregiving habits. This can really increase the resiliency in children, which is so important for children who have been exposed to domestic violence or other types of trauma. We can engage children, if possible, in age-appropriate safety planning, and we'll talk through some age-appropriate safety planning in a moment. Remember that letting kids know that they are heard and cared for goes a long way, and I would apply that to adults too. So this is a graphic that was created for DVIS. The acronym SAFE stands for Staying Away from the Fighting, Ask for Help, Find a Safe Adult Who Will Listen, and then that everyone knows it is not their fault. We can teach kiddos to call 911, to know like their address, their phone number, their parent's name, right? Find safe hiding spots in the home where they're not at risk of getting like hurt in the shuffle or trying to intervene, because that is where a lot of kids tend to get hurt. Find a safe place near the home, so whether that's a safe neighbor or, you know, in Tulsa, we have safe place signs everywhere, right? At fire station, libraries, Quick Trips, Tulsa transit buses, and non-responding IMSAs. So there's Quick Trips and fire stations on like every other corner. So there are a lot of safe places that children should really be taught that they can go to if things are unsafe in their home. And then, of course, pack a bag with important documents like birth certificates. That is for adults and children, but for children, don't forget some comfort items that can really go a long way when their lives are kind of picked up and shuffled around. I tried to put in as many nice images as I could to calm us and keep this as pleasant for such a hard topic. So a couple of colleagues and I have talked a lot about, and I'm sure many of you in your spaces have talked a lot about just like our own experiences and what's happening with us, right? That's why I put the nice picture of the landscape up. Just, it's really important for us to be aware of our own stuff and to be able to self-regulate. So in thinking about either in your personal or professional life, if someone is disclosing to you some things that you want to be thinking about, is their confidentiality at risk? You know, if you're in a noisy restaurant or courtroom or community center, you might want to say, hey, this is really important and I want to go somewhere private so I can really hear you and no one else will. Knowing your own triggers and your own limits. So if you are a survivor yourself, you want to think about, you know, what are your triggers and how do you prepare for those? That's not impossible to do, but I think it takes some intentionality. Knowing your own limits. So if it's maybe like a personal friend or a family member that's experiencing this, you know, are you willing to let this person move into your home and potentially bring this scariness into your home? Is that a risk that's real, you know, or is that something that you're not worried about? Can you help the person financially? Can you pick them up and take them somewhere else? Can you help them transfer to a new job? But maybe you're not willing to, you know, let your children go play at their home with their children, right? So you want to think about your limits when, whether personally or professionally. Sometimes, you know, I'll take a crisis call at the shelter and it will be just the scariest situation and the person The cab I know is going to take an hour to get there, and perpetrator will be home in 5 minutes, and this person doesn't have transportation, and I just do not offer to get in a DVIS vehicle and go and pick them up, because if I am unsafe, I am going to be no help to the survivor. So instead, what I might do is coach them to walk to like a nearby public place that's safe, so that the cab can pick them up there or something like that. I just can't tell you how many times I've been tempted to do things that are unsafe when I really slow down and think about it, or I hear colleagues offering to do things that are really either emotionally or physically unsafe. And when we're doing this work, our safety also has to take a priority, or we're going to not be effective. If we're in crisis, not going to be good. So to kind of wrap up that section, listen, believe, and then connect them to helpful resources. Okay, one other thing that has come up a lot that survivors have brought attention to in our work is just maybe some of the no-nos. So this proceed with caution is like, be careful not to engage in these behaviors. So try not to question the validity or truthfulness of disclosures. Believe survivors when they disclose. So we know that in trauma responses, sometimes memories get jumbled. We don't remember certain details, or we misremember certain little details. That is not for us to get in the mix of. Just if somebody's disclosing, they trust you enough, give them the respect to listen and believe. Try not to ask questions that aren't relevant to the immediate safety or concerns of the survivor. What happens there is you can get into a Pandora's box of trauma that the person is not ready to talk about, but here we go. And then maybe you as the provider or the person, you're not prepared to hear. And then you're in even more crisis, and you can't come back and focus on the immediate needs. So be really careful about that. Victim blaming, again, you can probably note that a lot of these apply to sexual assault survivors as well. Let's not say, well, why would you go back there? Why were y'all drinking together? Why did you let him have your phone? Why were you wearing that? None of that matters, right? Tell them what to do. So we really want to say that we are the experts, and we are going to help keep you safe. So you need to file a protective order, you need to go to shelter, you need to call the police. Well, again, for various reasons, some survivors will tell you if you ask them, it will only make things worse if I file a PO. Because remember, a protective order can be powerful for some people, but for other people, that's just a piece of paper, and perpetrator does not care. So you need to ask, do you think a protective order would be a good idea, or would it make things worse? You can try to force someone to enter shelter, but if they're not truly ready to leave and start over, this is going to go poorly. And then calling police, again, there are a myriad of reasons that we have already talked about, where someone maybe like me, that looks like me and shares similar identities, might feel that calling the police could be a good option. A lot of people do not feel that that is a good option, and for very good reasons, and we have to trust them in that. And then these two next ones, these are all things, these two things I have done before. It did not go well. Please do not do them. Telling someone that you know exactly how they feel. It doesn't matter if you were in a very similar situation, you were a survivor yourself, you got out of it, you are still a different human with a different experience. You do not know exactly how they feel. And then telling them that everything is going to be okay. We need to be very careful with both adults and children that we do not tell them everything is going to be okay, because we do not know that, right? There's all kinds of other helpful things that we've talked about that you can say and do. These I would really warn against. And then engaging in your own trauma disclosure, again, in certain very small situations maybe could be effective, but generally I think we all know that kind of puts them in a position where they need to care about us, and that we're not focused on them and their situation. The same thing with crying. Now, have I gotten tearful in my work? A million times. Yes, mostly it's I handle the situation and I go and have an emotional break in my office with the door closed or with a couple of trusted colleagues. But have I shed a tear or two because what is unfolding in front of me is just so horrific? Yes. Do I do everything in my power to not break down and sob because that is totally inappropriate? Yes, I do. If I have to say, hold on 1 minute and step out, that's what I will do. Again, we don't want the child or adult survivor to think that this thing that they've experienced, that they finally decided to tell a professional, is so bad that even the professional can't handle it. We also don't want to put them in a role where they feel like now they need to come for us, right? Because what is happening during a disclosure is really, even though lots of stuff is happening here, we take that to somebody later, either, you know, our favorite counselor or mentor or supervisor or colleague, and we process it in that way. And then obviously ignoring, not helpful, even though some of us, that might be our gut response, but hopefully now we all, if you didn't before, hopefully you have some new ideas of maybe how you could respond. So I just want to quickly highlight a couple of things. So there's a couple of articles here that talk about the DV violent versus nonviolent and criminal justice reform. The Oklahoma Attorney General is who certifies us to be a domestic violence certified DV program in the state. They do a fatality review. They have a fatality review board, and they do an annual report. This is the most recent, which is based on 2018 data that was released in 2019. If you're really interested in this and you haven't seen it before, really, really solid, interesting, heavy information there. A couple of articles on Jacqueline Campbell's research and the LAP program. And then this final article is about the needs of children in domestic violence shelters. If you ever work with children who have been exposed to domestic violence and you have not read this article, it is the most like easy to read, accessible, relevant information about children and how trauma impacts them, and helpful things to say. And you will see some of the things that I shared in that article. And then there's additional resources. The first low impact disclosure is that sliming article that's really interesting if you find that you're in a space where everyone just like dumps all this heavy trauma without prefacing or preparing you, and you're like, why does this keep happening? This might be a good article to read and bring to your team. Some specific safety planning around tech and helping someone who is experiencing DV during COVID pandemic, some national resources, and then that Strangulation Training Institute that I mentioned previously. This is our crisis line at DVIS if you're in Tulsa area. This is my work email. And then I think we are going to open it up for questions or comments. Sorry if I talked a million miles an hour also. I do that.
No, thank you. It was very interesting and very important. And thank you also for adding the things about the children. I know that I didn't ask you to do it, but Haruv is about children. And so thank you very much. And I will let people take a few seconds and start. And I will start with the first one. If you can tell us a little bit what happened during the coronavirus period, regarding domestic violence in Oklahoma and the Safing House, how did it function during this time when we needed to be isolated and, you know, and things like this?
We were really fortunate to have some additional financial resources that we were able to start bringing in new survivors and directly into hotels. And we're partnering with multiple hotels across Tulsa to find ones that are in safe locations so that we don't have to bring survivors directly to shelter. So we can kind of give them a quarantine period, make sure they're not exhibiting any symptoms before we bring them to shelter. And also we've had a temporary period where we put clients who were still working, so they were coming in and out a lot. We were able to relocate them to hotels temporarily, again, just to limit the coming and going. For a while at the very beginning, it was really quiet, which was very concerning. We assumed that was because people just don't have access to privacy anymore to call the hotline if perpetrator is there around them all the time. We are slowly seeing an uptick in more high lethality calls of people who are finally now able to, because either perpetrator is going to work or they're finding creative ways to get a private moment to call. We're also about to open up a text line this week to increase access, and we have gotten some like messages through social media. I don't know yet that we fully have seen the intense amount of uptick in DV in Tulsa, but we're trying to do what we can to prepare for when survivors start reaching out. But yeah.
You know that in Israel we had an initiative during this coronavirus, as you said, that women are with their perpetrator at home and maybe cannot ask for help, and they had this initiative in the news that you only need to text a friend or some text numbers. I need a new makeup, or do you have an eyeliner, and something like this about facials that women are using. That means that you are in danger and you need help. So
yeah, we've actually, since I've been at DVIS, we've had callers call before ordering like pizzas. And at first we're like, no, this is a crisis hotline. And they're like, no, I need a large pizza with pepper. And then we're like, okay, we see what. And so then we were like staying on the line and trying to pick out information, what's your address? And we're saying to them, like, we're going to call police to come and do a wellness check. And they're like, yep, that would be great. Yeah, just as soon as you can get that. And that's some pretty intense phone call when we receive things like that. But it's also brilliant and kind of just acknowledges how clever people can be in times of crisis to get the help that they need. But I don't think we've had a formal like direction like that here in the U.S. Gal. That's pretty cool that they were doing that.
Priscilla, you wanted to ask a question? You can open the mic.
Yeah, I'm gonna ask it, Gal. She was wondering how cultural considerations may apply beyond legal status.
I would probably want Priscilla, you to just expand a little bit on what you mean.
Simply how DV is addressed when the family is not as acculturated to the United States.
Mm-hmm. I think we rely on the client as the expert to know what they need and what they feel comfortable with. There are a lot of families that have different cultural considerations that maybe some of those are the ones that maybe we talk to time and time again and just continue to safety plan and let them check in with us. And maybe it takes a really long time of us just slowly building trust and rapport that we're going to be a safe place that respects them. Sometimes it's just making like simple accommodations around like dietary needs or their needs around their faith accommodations, which we do welcome. We just need to know, which is part of our responsibility to make sure that we're asking a lot of culturally appropriate questions. See what else. I don't know. I mean, a lot of people view their experiences differently. So I think it's just case by case and really relying on the survivor to tell us kind of what their needs are. And then we see how we can meet those needs. But that's a great question. I don't really have some specific examples that wouldn't possibly risk somebody's confidentiality that I can think of, but. Other questions, comments? I also really do welcome critical feedback. If it would have been more helpful, I was trying to think of like what's most helpful. Let me just say that at our agency, like we haven't arrived in any way. We still mess up. We're still messy. We're still learning every single day. I don't think that you can ever get out of that learning mode in this work. Just things change so rapidly. And yeah, if there was any feedback of what would have been more helpful, I'm happy to hear that too.
We have one more question, DeJon. Have you had a lot of people needing services that have been exposed to the COVID-19 during this time?
Thankfully, no. We've had a few scares. We've had a few people with symptoms that got tested and tested negative. And we've had a couple people who have come in who were potentially exposed, but we haven't had any positive COVID cases from any of our survivors or staff at this time, which again makes us extremely thankful and fortunate in these uncertain times.
Do we have any other question? So I think that we are done.
Okay.
Thank you, DeJon.
Yes,
Thank you. It was very important and of course very interesting. Rona is saying great presentation, and you can take a moment and look at the chat now that you finished. I think it will be very interesting for you.
Okay.
And Christina, would you like to say a few words about CEUs?